Dr. Phil reporting for Rodeo News today. I'll be your leading expert on clostridial myositis. So clostridial myositis is death of the muscle tissue caused by the clostridial bacteria. The disease is also called clostridial myonecrosis. So clostridial is the bacterial genus, and myo means the muscle, and necrosis means the death of the living tissue. This bacteria form spores, which are very hardy and they're very resistant in the environment and can survive for a very long time. They are obligate anaerobes, which means that they can survive in the absence of oxygen and they do not survive in the presence of oxygen. So oxygen is very dangerous for these types of bacteria. So how does your horse get it? So most horse owners have to provide their horses with shots to keep them healthy. A very common shot is the flunixin, which is also called venomine. And there's two ways this disease can be introduced into the horse. It can be inoculated or it can have the growth. So inoculation, the horse has the bacterial spores growing on its skin from the natural environment that they acquired. And when the horse owners or the veterinarian is going to give the shot, they introduce their bacterial spores into the muscle from the skin, and they inoculate it, they introduce it into the muscle. And if the injection causes inflammation or causes a wound, it will have the chance of oxygen not being transported into the muscle, having the proper environment for the bacteria to grow. In the case of the growth, the bacteria are already in the muscle, and when the muscle gets damaged from the injection or gets inflamed from the medicine, it can lead to the loss of oxygen and have, again, bacteria growing. And once the bacteria start growing, they begin to eat the muscle away and the tissue begins to decrease. So what are some signs and symptoms? Most common sign is the swelling. You have rapid swelling of the neck, will have hot and painful, your horse will be in much pain, and the horse will be reluctant to move his neck because it will be very painful. Another symptom you could feel is the crepticus on their skin, that they'll have gases growing that will be caused from the bacteria, and when you will touch the skin of your horse, it will feel very bumpy and lumpy. The way you will diagnose this disease is usually they will have a hematology exam, which is a blood test, or they will also take a sample from the wound culture, and they will grow it to see what kind of bacteria is growth on there. There are two types, most common bacteria that can cause this disease. Clostridium perfringens, which can have a mortality rate of 73%, and Clostridium septicum, which has a mortality rate of 50%. Although Clostridium perfringens is the most common case seen in horses. Treatment and prevention. The main way you will treat this disease is through the high dose of intravenous penicillin. Also, you can perform surgical debridement or fasciotomy of the infected area. Another way is to introduce oxygen to the infected area, and the ways we can introduce oxygen is through having a hyperbolic chamber or cut open the wound so they can allow for the flow of the oxygen. The way we can prevent this is to try not to give your horses injections on the muscle. Try injecting them on the veins or giving them medication orally. Also, applying alcohol on the skin before injecting the horse does not work, since these bacterial spores are very resistant to alcohol. So thank you for tuning in, and now we'll go back to the front desk.